Hey everyone, so my name is Jordan Seward and I decided to do relapsing fever. I chose to do relapsing fever because I went camping with my family a long time ago when I was about 10 in Colorado, and my cousin actually had relapsing fever. And at the time I had no idea. I just knew that she was really sick and we weren't really sure why, but I guess my parents and like all my aunts and uncles knew why. And I was going through the textbook the other day trying to figure out what I was going to do this project on, reading a couple out loud. And my parents were like, "Oh, that's what your cousin came down with that one time in Colorado." And I was like, "Oh, okay, I guess that's what I'll do on this project. Like, I'd like to be able to learn more about it and connect the dots and kind of see why she was so sick that one time when we were kids and we were camping." So, relapsing fever is a rare infection that's often associated with sleeping in cabins around mountainous areas of many different countries. It's spread through the bites of soft ticks, and soft ticks are oftentimes found on mice, squirrels, and or chipmunks that have nests in these cabins, and they can go unknown for many of years, and they usually burrow in deeply and are hard to remove. Most cases occur in the summer months when families are outside enjoying their cabins, camping, and spending quality time together. Some of the symptoms are fever, jaundice, rose colored skin spots, headache, muscle and joint aches, chills, and vomiting. So, the pathogen associated with relapsing fever is the spirochete genus Borrelia. Um, It is a long and spiral shaped bacteria. And if you look at the bottom right hand corner, you'll see the red blood cells and the white blood cell, which is in the top right corner of the photo. And then you'll see the little tiny spiral shaped bacteria, and those are the spirochetes. This disease, a random fact, this disease has about 5% mortality rate associated with specifically spirochetes. Spirochetes are a gram-negative bacteria, and they're approximately 5 to 20 microns long, and they're visible via light microscopy. So, relapsing fever is transmitted through ticks. There's multiple different types of tick species that I'll cover in the next slide, but the most relevant is the Ornithodoros hermesii, which is responsible for more than half of the transmission of cases of relapsing fever worldwide. And pretty much the soft tick bites you, and the spirochete goes into your bloodstream and infects you. Borrelia species, or soft ticks, there are three different types that I'm going to talk about. The Ornithodoros hermesii, which I talked about in the previous page, are found in coniferous forests, which means they are found in needle-bearing evergreens. They rest at altitudes of 15,000 to 8,000 feet, and or 1,500 to 8,000 feet, excuse me, and feed on chipmunks and squirrels. And the Ornithodoros parkeri and the Ornithodoros turcata prefer caves at lower altitudes and feed on ground squirrels, prairie dogs, and burrowing owls. If you look at the bottom right hand corner, I have a picture of a tick before feeding and after feeding, and I thought that would be interesting to show you just how much they really survive off of feeding off of others. A couple of important things to know are that soft ticks can live up to 10 years. They'll feed off blood more than once in their life, which means they could be feeding off multiple different humans, multiple different animals to get this blood supply, and then they can also pass the infection on through their offspring's eggs. So, relapsing fever is interesting, and the name kind of gives it away, but it's characterized by episodes of symptoms that last approximately 3 days and are separated by 7 days of afebrile. And afebrile means that there are no symptoms and no fever within those 7 days. And before I go on any longer, I want you to take a look at the bottom right hand corner where I have the picture, and it will show you the time period of this disease. So you'll have the incubation period, which lasts approximately a week. Then you'll have the fever of 3 days, no fever or the afebrile, and then the fever, no fever, fever, which is why we call it relapsing fever, which I can get into now, which is during those 3 day periods, you're going to have two different types of symptoms, which are the chills phase and the flush phase. The chills phase is when a patient develops very high fevers and possibly becomes delirious. And the flush phase is when the patient's body drops rapidly and they become drenched in sweat. Now, these two phases only happen in the red phases, the fever phase. So, relapsing fever is diagnosed via physical examination by a professional. There's also blood examinations that they can perform if they believe that you have had the disease for longer than they would like and there's no time to wait. It's important for doctors to consider travels and recent geographical location of the patient when diagnosing, as spirochetes can often appear as helicobacters in a blood staining test. It's interesting, in the right hand corner, you'll see what you think would be a spirochete is actually a helicobacter. And if you remember from a couple pages before, that looks very, very similar to the spirochete. We're able to treat relapsing fever with antibiotics. Um, the doctor will monitor the first round of antibiotics, as there can be adverse reactions, and there's been like an increase in adverse reactions within the last 10 years. The most common antibiotics are tetracycline and doxycycline, and most treatments begin working within the first few days and no more doses are required. However, I would like to note that even though the dosages work within the first few days, the part that makes this really interesting is that it will relapse. So you might feel better, or a patient might feel better on their antibiotic, but it also might be that during their afebrile period, and this might cause a patient to stop taking the antibiotics because they think they've gotten better and then they've gotten worse all over again, which is interesting because that's something we just covered in class and is probably a reason why the antibiotics are also monitored so heavily within the first round of antibiotics. And it's interesting that they do note that there might be, and there's usually multiple rounds of antibiotics. So, prevention, there's really no immunization you can do to prevent ticks from biting you. However, there, of course, is bug spray with um, DEET. So, the most effective form of prevention is through insect repellent that contains DEET, because some do not contain DEET, but we would need the ones that contain DEET to repel ticks. If you have your own cabin, you'd of course want to make sure that you've contacted a licensed pest control professional who can safely identify, treat, and prevent future rodents. And lastly, do not try to remove nests without professional help, as that can just exacerbate the situation, and it's not good for you, it's not good for the animals, and it's definitely good for the ticks. And these are the sources I used. I just want to say thank you so much for listening to my slideshow, and I had a really good time learning about this. It was really interesting, kind of knowing more about the progression of this disease and what happens, because I remember so specifically my cousin's symptoms and how she would be playing with us one day and the next day she'd be like in the tent, like sick as a dog. And I never realized that it was relapsing fever, and it was kind of cool to connect the dots. Anyway, have a good night and thank you so much.